Today we will study about the Saphenous vein. So let's start our class. We will go through some points of clinical orientated anatomy. Here you are seeing various varicose vein. Varicose mean tortuous and dilated. So in both legs you can see various varicose vein. Again, this is another a point of clinical orientated anatomy. You can see varicose vein in this patient. So what is varicose vein? The great saphenous vein and its tributaries sometimes become varicose. So the great saphenous vein and its tributaries sometimes become varicose or dilated. Here, these are the varicosities, and they are formed due to involvement of the great saphenous vein. Great saphenous vein actually contain up to 20 valves, mostly below the level of the knee, and they have cusp. The cusp of their wall do not close in this condition. Normally, they get closed, but they do not get closed in the varicose vein. So, in this condition, they are incompetent and they no longer function properly. So, when they do not function properly, this is the result. So blood flows inferiorly in the veins under influence of gravity, resulting in varicose vein. Varicose vein are common in the posterior medial aspect of the leg and they cause discomfort. Here you can see the varicose vein. Another venous disorder, you can see the leg of the patient is very much swelled and erythematic. So this is the condition of DVT or deep venous thrombosis. So what is DVT? Deep venous thrombosis. DVT, if involves the deep veins of the lower limb, is featured by swelling. Here you are seeing the swelling, warmth, so it is hot to touch, and erythema, and it is red due to thrombosis in the deep veins. So what are the causes of this DVT or deep venous thrombosis? Venous is an important risk factor for the DVT. Venous stasis happens due to loose and incompetent deep fascia that cannot resist muscle expansion that reduce effectiveness of the musculovenous pump. Pressure on the veins from the outside, as in the prolonged hospital stay, as by the bedding, a tight cast or bandage, muscular inactivity, as in overseas flight. So all these are the known causes of the DVT. DVT is a life-threatening. The most life-threatening complication is pulmonary thromboembolism, where a large thrombus gets break from the veins and it travels towards our lung. And in the lung, it can cause obstruction of a pulmonary artery. So what will happen if our pulmonary artery get obstructed? A very large embolus can totally obstruct main pulmonary artery that immediately result in the death with underlying pulmonary infarction. So first event is DVT, and after the DVT is the obstruction of the pulmonary artery, and pulmonary artery will result in the pulmonary infarction, and the pulmonary infection can lead to death. And these are the complications sequelae of the deep venous thrombosis. And here this is a picture of the saphenous vein graft. This is our saphenous vein, and here this is our coronary artery, and here you are performing coronary artery bypass surgery, and here you are using a venous graft that is taken from the great saphenous vein. So the great saphenous vein is used in the coronary artery bypass, or it is short form is CABG, coronary artery bypass surgery. In this surgery, the vein is inverted. Why it is inverted? So it has various valves, so the valves do not get obstructed. And why great saphenous vein is the vein of the choice in this procedure? because this vein is very accessible at this point, and there is a large distance between its tributaries and the perforator, so a usable length can be obtained when we take the saphenous venous graft. Its wall contain a high amount of muscular and elastic fiber than do superficial vein, and removal of the great saphenous vein does not produce any significant problem in the lower limb circulation if the deep veins are intact. In fact, removal of this vein facilitates the superficial to deep venous drainage pattern. So that are the reasons why we take the saphenous venous graft, and in fact, it helps from superficial to deep venous drainage. In this diagram, we have seen the saphenous venous cut down. So this is a procedure of the saphenous venous cut down. Saphenous venous cut down and saphenous nerve injury. Sometimes we did not find any visible vein in infant, obese people, or in patient in the shock. So how will you assess IV line in such patient as their veins are collapsed? Here, great saphenous vein can be assessed by making a skin incision just anterior to medial malleolus. This procedure is called a saphenous cut down. By this, we insert a IV cannula for various purposes in the great saphenous vein. And the great saphenous vein is accompanied by saphenous nerve, which runs just anterior to the medial malleolus. And in this procedure, the saphenous nerve is vulnerable in such procedure. And if the nerve get damaged, the patient may complain of numbness and pain along the distribution of the nerve in the foot. So this is the pictorial representation of the great saphenous vein, and here you can see the saphenous nerve is running along this nerve in the leg as well as in the thigh. Saphenous vein or long saphenous vein. Its name is long saphenous vein because it is the longest vein of our body, and it began as the upward continuation of the medial marginal vein of the foot. This is the medial marginal vein of the foot, and this is the dorsal venous arch. It moves in front of the medial malleolus. So here you can see it is moving in front of the medial malleolus. This is the lower 1/4 of the medial surface of the tibia with the oblique course. So here you can see it is crossing the lower 1/4 of the lower surface of the tibia in an oblique course. Then it moves up behind the medial border of the tibia towards the knee, where it lies a hand breadth below the patella. So here you can see it is lying about a hand breadth below the patella. And then its course is in the thigh, where it is spiraling along the medial border of the thigh, and then it is crossing this opening. This opening is called saphenous opening. Then it courses forward with a spiral around the medial aspect of the thigh. So this is shown the spiral course in the medial aspect of the thigh. Here it terminates by passing through the cribriform fascia around the saphenous opening. So cribriform fascia is the fascia that is closing over saphenous opening. And saphenous opening which lies about 3 to 4 centimeters below and the lateral to the pubic tubercle in the femoral vein. And ultimately this vein is draining into femoral vein. There are usually 4 venous tributaries that correspond to 4 cutaneous branches of the femoral artery. And these are superficial circumflex iliac, superficial epigastric, superficial and deep external pudendal. So ultimately these are the tributaries that drain into the great saphenous vein near its opening in the cribriform fascia. These all join the great saphenous vein in the region of the saphenous opening in a variable pattern. And here you are seeing thoracoepigastric vein that get open in the obstruction of the inferior vena cava. So all these dilated course is due to our thoracoepigastric vein. So what is thoracoepigastric vein and how it get open in the obstruction of the inferior vena cava? One of the tributaries of the Great Saphenous Vein, superficial epigastric vein, form a longitudinal channel that connect the lateral thoracic vein by the formation of the thoracoepigastric vein. So superficial epigastric vein and the lateral thoracic vein are connected to each other by this thoracoepigastric vein. This pathway provides a communication between superior vena cava and the inferior vena cava, and it becomes prominent in the cases of the obstruction of the inferior vena cava. Two other tributaries are anterolateral and the posterior medial veins of the thigh. It also joins the Great Saphenous Vein near the saphenous opening. Now we will talk about the perforator of the Great Saphenous Vein. Perforator are basically anastomosic vein that connect the Great Saphenous Vein, that is a superficial vein, with the deep veins of the calf. And their location is highly variable, but usually they are as following. One just below the medial malleolus. One is located just below the medial malleolus. And one about 10 centimeter above the medial malleolus. So they are giving different names. Here, Cockett's perforator of the posterior arch vein. I will explain it later. One end about the middle of the leg. This is third perforator. The fourth one just distal to the knee. Sometimes this is given a name White's perforator. And a long perforator in the adductor canal, which is sometimes named Hunterian perforator. So these are perforator that are connecting our superficial vein, that is Great Saphenous Vein, with the deep veins in our lower limb. The walls in these perforating veins are directing inward. The walls are found where these veins pierce the deep fascia and where they join the deep veins. So they have walls actually. What is posterior arch vein? Posterior arch vein is a longitudinal trunk that connects the perforator located in the leg. So these perforator, one in the location of the medial malleolus, one 10 centimeter above the medial malleolus, and one in the middle of the leg, and that again, these perforator are connected to each other by the posterior arch vein in the leg. Some perforating vein in the leg are connected with the posterior tibial vein, and some other join the venous plexus in the soleus, which is the peripheral heart. So these are all the connection of our superficial vein with the deep vein. So that's why they are called perforators. Thank you.